Hello, everybody. Thank you so much for joining us today for our first Facebook Live event. And we are excited to try this out. So we look forward to your feedback and suggestions on how we can improve it. We set up this Facebook Live event just for our CPAP members because we know that you've been following the efforts to repeal and replace the Affordable Care Act, and we wanted to give you an update on what's going on here in Washington, D.C. And because it's our first time, we wanted to keep it to, in the family, but next time maybe we'll make it a broader Facebook Live. So when we planned this last week, we thought we were going to be talking about the wonderful bipartisan efforts to stabilize the marketplace. And it turns out that things have changed in Washington. So we'll get to that in a minute. But first, I just want to introduce you all know Lindsay Houff, our public policy manager, and give a shout out to our friend Kelsey Napodi, who is home with her daughter, Frances Jane, or Franny Jane, who was born 3.5 weeks ago.
Brand new CPAP member.
Our CPAP baby, Franny Jane. And maybe Franny Jane's watching if you are. Hi, we miss your mom, but we're carrying on without her until she comes back in the very near future, although you probably want to keep her to yourself for a little while. So before we talk about what's going on with the legislation that's been proposed by Senators Graham-Cassidy, Heller, and Johnson, I just want to give a really quick recap on why the Affordable Care Act is so important for cancer survivors and cancer patients. First of all, the Affordable Care Act protected people against discrimination based on their pre-existing conditions. Before the Affordable Care Act, if you're a cancer survivor and you didn't have insurance through your employer or through Medicare or Medicaid, you could be discriminated against. Insurers could either refuse to sell you a policy or charge you outrageous premiums because of your pre-existing condition. The Affordable Care Act requires that everyone is charged the same based on where they live and their age, but not based on their medical conditions. The Affordable Care Act also expanded Medicaid, and in about 30 states, they expanded Medicaid so that people who previously weren't eligible for Medicaid could get Medicaid. There are about 20 states that didn't expand Medicaid, and that's coming into play in the Graham-Cassidy legislation because those folks have not had the expansion in the number of people who are covered because they chose not to expand Medicaid. The Affordable Care Act also had a set of essential health benefits that all plans had to cover. And without those essential health benefits, you could buy a plan that may not cover the things that you need. And so the essential health benefits basically set a standard so that you know that you're buying coverage that's relatively meaningful. You still may have high copays, high deductibles, but at least it's going to cover the kind of 10 essential sets of services. And then the other thing that's really critical for cancer patients and survivors is that the Affordable Care Act outlawed lifetime and annual caps so that you couldn't be, if you hit a certain maximum in a year, you couldn't be denied coverage of claims after that point or in a lifetime. So as we know, President Trump and the Republicans have been campaigning on the promise to repeal the Affordable Care Act for 7 years, really. And we were pleased and surprised that their efforts failed this summer. We really were hoping that we had put it behind us with a dramatic vote late at night as Senators Collins, Murkowski, and McCain voted no on several different efforts to repeal the Affordable Care Act. But there's been a huge amount of pressure on Republican senators to follow through with their promises to repeal and replace the Affordable Care Act. And now we're in a situation where because of the legislative mechanism that they're using, where they only need 50 votes, they have a deadline of September 30th, which is next week, to pass something. Otherwise, they will need 60 votes, which they can't even get 50, so they're definitely not going to be able to get 60. So there's a last-ditch effort headed by these senators to repeal the Affordable Care Act, and it's really arguably worse than all of the other bills that were defeated this summer. So I'm going to let Lindsay tell you a little bit more about what's so bad about the Graham-Cassidy legislation.
Yeah. Thanks, Shelley. So the Graham-Cassidy legislation really puts at risk all of the great patient protections that you talked about with the ACA. So Graham-Cassidy was written by Senator Graham of South Carolina and Senator Cassidy of Louisiana. And the legislation would basically eliminate all of the ACA funding, and it would eliminate the Medicaid expansion, and it would lump that funding into block grants and give it to states so that they could create their own health systems. And that would be really unpredictable because, who knows what each state would do with that system and what it would look like for patients. But we do know that the bill would allow states to eliminate or opt out of essential health benefits, which you discussed, that cover, really critical services, especially for cancer patients, like ER visits, hospital visits, prescription drugs, chemotherapy, and other critical services. In addition to that, it would also allow states to waive community rating. And so in the ACA community rating, like you said, requires that insurers charge healthy people the same as sick people. And so under this bill, states could charge, insurers could charge healthy or sick people more, and they would get less coverage if they weren't protected by the essential health benefits. So it really puts patients, especially, cancer survivors, in a tough situation, and this bill would be really harmful for a lot of Americans. And with the block grant, the money would be substantially less than is now in the ACA. And so, undoubtedly we would see millions and millions of people who are uninsured. And another big issue we don't know exactly how many people would be uninsured because the Senate is running up against a really tight deadline of September 30th if they want to get this passed with a simple majority and in a very partisan manner. And so now they don't have time to get a full Congressional Budget Office report, which is critical for members to know the impact that this huge piece of legislation would have on our economy and on coverage and on patients. And the senators who will be voting on this bill are really going to have a blind vote. They're not going to know the full impact, and that's really concerning for us.
So Lindsay, I just want to break in for a quick second and just welcome anybody who's joined us since we started our Facebook Live broadcast. We're talking about the latest efforts to repeal the Affordable Care Act and the legislation that's been proposed by Senators Graham and Cassidy, Heller, and Johnson that's gaining a lot of momentum, and we're very worried that they will be voting on it next week. So if you can keep going, I just wanted to welcome anybody who's joined us since we started.
Hi, thanks for joining us. So basically Graham-Cassidy would be terrible for patients. It would eliminate a lot of patient protections that exist in the ACA. It would eliminate a lot of funding. It would eliminate Medicaid expansion, and it would cap Medicaid, the traditional Medicaid program. So we're really concerned about that because Medicaid covers millions of cancer patients who are lower income. And so that would be really devastating for them.
So Lindsay, let me just ask you, so you talked about the Congressional Budget Office that has not had a chance to fully analyze this legislation. And so the CBO has been giving us estimates throughout the year when we have had these various different repeal efforts of how many people would lose coverage. And because this is basically putting all of healthcare in the hands of states, it's a very complex analysis that they have to go through to try to figure out what the states will do and what that will mean for the number of people covered. So we don't have their estimate, but there have been a lot of other estimates that show that there will be millions of people who would lose coverage. But also, I think one of the biggest issues is that there's a huge transfer from some of the large states that did expand Medicaid to states that chose not to expand Medicaid. And so there's going to be some states, most states really are going to lose money on this. There's a few states that are going to gain, but a lot of states are going to be big losers, especially some of the states that chose to expand Medicaid.
Yeah, the bigger states and states that chose to expand for sure. And so that would mean, 31 states, I think it was 31 states expanded. And so this would really hurt all of those expansion states and the patients that live in those states. And so that's really, really concerning. And to add to the long list of concerns that we have about this bill, there's a really strange funding cliff in the year 2026. So basically, the funding for the block grants just disappears in 2026 and would have to be reauthorized. And so we can't imagine, what would happen then. And I just think that for states, like, this is a huge burden, and it would be completely unpredictable, and it would put patients at risk again, even more so.
So one of the big arguments that some of the sponsors are using is that this is taking the money and handing it to the states, getting Washington bureaucracy out of the decision making. What's been the reaction so far of states to this?
So there were there have been a lot of governors to speak out saying that Republican and Democratic governors who've written letters to senators saying that this bill would really hurt states. States are already struggling with funding as it is, and for states to take on this huge burden of creating their own healthcare system, and in 3 years, like, that's not a lot of time. It's just not realistic, and it would be terrible for patients, terrible for Americans. And I think governors know that, because they would be the ones having to take on that unreal responsibility. So,
I mean, and to be fair, there have been some some governors who've said that they would like this extra money. Of course, those are the states that are going to be getting a lot more money from this. But a large group of bipartisan governors yesterday said, we don't want this. This is a huge responsibility for us. And it's almost like the Senate is just punting to the states and using the argument of federalism, which goes over well with their constituents, to say we're going to put it in the hands of states. But it's a huge burden on the states, and it's not nearly enough money to actually cover the people the way that the states would need to.
Right. And, we were really pleased to see finally bipartisan work that was underway in the Senate. Senator Alexander, a Republican from Tennessee, Senator Murray, who is a Democrat, they were working together, and they were in the Help Committee, and they were having hearings, an open and transparent, productive process. They were getting input from stakeholders in health policy, and they were working towards a stabilization bill that would shore up the ACA and improve it. And we were really excited to see that effort. And so now that the Graham-Cassidy has come up, it's completely undermined that effort. And Alexander, I think yesterday, said that they were, tabling that bipartisan stabilization bill because of this Graham-Cassidy legislation. And so, we were really disheartened to see that there won't be a bipartisan approach to healthcare, which is really disappointing.
Mm-hmm.
But
so what do people need to do?
Okay, so it feels like I get that there might be a lot of advocacy fatigue around this, because it feels, for months and months we've been saying the sky is falling, and they've tried to repeal several times, but this is it. We talked about the September 30th deadline. This is the real deadline for this year, and this is their last ditch effort, and that's how their Republican leadership is really proposing this to their members as this is it. This is our last chance. And so, as advocates, we need to view it in that sense as well. Like, this is our last chance. If you have been calling, keep calling. If you haven't, this is a really critical time to make sure that you call your members of Congress, especially if you live, there are still some members in states, some senators that are undecided. So if you live in West Virginia, Maine, Colorado, Ohio, it's even more critical that you call Alaska and Arizona. Yes.
Right. And if you know people in those states, ask them to call, because those are really critical. As we mentioned before, there were 3 senators who blocked this in the summer.
Yep.
And Senator Collins from Maine, who is seems to be pretty stout in her opposition to this legislation, but she needs to hear from her constituents to shore her up, because it's tough to make this vote against what the party wants, and especially when the party's campaigned for so long on repealing and replacing. Senator McCain has really focused on the process, and that this is not being done through regular order. And by regular order, he means a committee process where there are hearings and markups and amendments. And this is no different. This is the process for this is not going through regular order. They have scheduled a couple of hearings next week. It's unclear who's going to be speaking at them, but it's clearly an attempt to show that we're trying to go through some semblance of regular order. But the truth is, it's not regular order. But Senator McCain said that he really deferred to his governor on this, and Governor Ducey from Arizona has backed this legislation. So it's really a question of what he will do. So anybody in Arizona who has any contacts to him, please reach out to him, because that's really, really important. Mm-hmm. Lisa Murkowski in Alaska has been very stout against the legislation, but again is under a huge amount of pressure, and is right now looking at what does this mean for Alaska. Mm-hmm. And so they need to hear from us. And I think it's also especially Senators Portman and Capito from Ohio and West Virginia. But really, all of your senators need to hear from you, even if you're not going to change their vote. They need to hear from you. Mm-hmm. And if they're supportive of of the efforts to keep the Affordable Care Act, they need to hear from you. So
Right.
don't think that just because you live in a state that's not one of these critical states, you don't need to call, because you do.
Yeah.
We really need everybody to call.
I heard yesterday that Democratic senators were, encouraging people to call them and let them know that they don't want this bill, even though they know that they wouldn't vote for it, because they want to be able to go to their colleagues and say, I've had, X many calls about this, and this would be really bad for my constituents, and they care about this, and they're contacting us to let us know. And so the NCCS is here to help you in any way we can. We have a great tip sheet on our website, Protect Our Care, and we have an excellent hotline where you can just call and it would patch you through directly to your members of Congress. And that number is 844-257-6227. And we'll post this on our Facebook page as well. And it's all over our Protect Our Care page, which has other resources so that we can support you, and you can call your members and get the message across that the Graham-Cassidy would be devastating for cancer patients, and it's unacceptable.
And it's an easy way for people who maybe haven't done this before to make a phone call, because when you call the hotline, it gives you a little quick talking point and an explanation of what to say. So if you're sharing it with people who maybe haven't been active on this, but you ask them to make a call for it, you can tell them it's very easy. They don't have to know all the details, but it's a way to make your voice heard really quickly and easily.
So we have a couple questions that have popped up. I see Yvonne said, I've been telling my legislators to vote no on this legislation. What else can I say? That's a great question. You can actually say, we know the ACA isn't perfect, but we were really encouraged to see a bipartisan effort to improve it. And so I think that another message to go along with opposing Graham-Cassidy is to say, let's focus on a bipartisan effort to improve the ACA and make sure that all Americans and all patients have access to comprehensive health care that they need. So I think that's a really strong message, because a lot of members do want to work in a bipartisan manner to make it better.
I think another, a message we can really hit home is, for cancer survivors, the pre-existing condition protections are essential. And this does not guarantee them. I mean, it puts it on the states, and you may hear the pushback that, the states will keep those protections, or there's no real true guardrails, as they call it in the bill. It just says that as long as the state maintains access to affordable health care. Well, that's very broadly defined. It does not guarantee a protection like the Affordable Care Act does. So I think if you're a cancer survivor, you can say, I'm worried that I'm going to lose my health care, and make it really personal to you. And I think another point is, whether you have access to insurance shouldn't depend on where you live. And if we throw this back out to 50 states to change the rules, and then you don't have that peace of mind to know that if you had to move, you would not be able to get care, or where you live, you would not be able to get care. It shouldn't depend on where you live. These are basic protections that are really important to cancer survivors. And speaking of the pre-existing conditions, Jimmy Kimmel talked last night. If you haven't seen it, I would go check it out. He, famously back when this was being debated earlier this year, talked about his son who was born with a congenital heart defect, and that had the Affordable Care Act not been in place, he could have not had coverage for the expensive surgeries that he needed, or he could have reached his lifetime caps in his first, weeks of life. And so he had Senator Cassidy, one of the proponents of this legislation, on his show back earlier this year. And Senator Cassidy is the one who talked about the Jimmy Kimmel test to make sure that people with pre-existing conditions are protected. And now Cassidy is spearheading this legislation that does not actually protect people. Unfortunately, they're actually trying to sell this as it still maintains those protections. It does not. And so Jimmy Kimmel did a great job last night of explaining. I thought, for an entertainer who's not a policy wonk, he did a pretty darn good job of explaining it and saying, this does not pass the Jimmy Kimmel test that you created, and you told me that was important to you. So if you haven't seen it, check it out, share it on social media. I think that it could be a really good tool to help people who maybe don't really understand what pre-existing conditions are, to have it in a very tangible way, with Jimmy Kimmel's example of his infant son who he said that maybe the Jimmy Kimmel test should be, if your dad is not Jimmy Kimmel, you won't be covered, because he knows that he's fortunate enough to be able to afford insurance, but what about the people who are not?
Yeah, exactly. And it's not just high profile people that are coming out against this. Almost every patient group that we know of is in opposition to this. And we actually just posted yesterday on the CPAT page about a great infographic that shows a lot of the cancer groups coming together and saying that, this would not be a good bill for cancer patients because it eliminates so many critical patient protections. The American Medical Association has come out saying that, it violates the do no harm clause that they are proponents of, and
AARP.
And AARP, yeah, obviously. And
NCCS joined, as Lindsay mentioned, with almost 40 cancer groups, patient and provider groups that oppose this legislation. So there's not really a lot of people for it. They're just really there for repeal, not necessarily for this particular legislation or the substance of what it would do, but the fact that we said we were going to do it and now we have to do it. And I think we just need to say, wait a minute, take a step back and let's get this done right and in a bipartisan manner, as opposed to just gutting the program that's helped so many people.
And so Jen, yes,
Hey, Jen.
Hi, Jen, in Arizona, key state.
Jen has been
we need
calling
McCain to.
Senator McCain.
Yes, thank you, Jen. And we will definitely repost the infographic, and that would be great if you guys could share that on your social media. We'd appreciate that for sure. And we got another question about timing for contacting your members. So like I said, the Senate is up against the September 30th deadline. And so that means in the next week, by the end of next week, likely there will be a vote. And so calling your members right now, today, and then keep calling and keep contacting them over the next week, send them Twitter messages, call them, email them, get your friends and family to contact them as well. So
you can check out your senator's websites too to see if they're going to any events in your area over the weekend. And some are actually in the district now because I think they have I think they're in recess, right?
The House is in recess.
The House is in recess. Some senators are too. So check out and see if they have any events that you want to go to in your community and talk to them. Or call people that if you know anybody in their local office. You can call both the local office and the DC office, and the local office will get that message to the DC folks.
Yep. Okay.
Anything else?
If there are any other questions, feel free to post.
Thank you all for joining us, and thank you for all of your work to try to make sure that patients' voices are heard in this debate. And we will keep sending updates on the Facebook page and on our Twitter. And if there's anything else we need from you, we'll let you know.
Yep. Thank you.
Thank you.